Hi, I'm Dr. Carlisle Scott from HealthSource of Bismarck South. Today what we're going to do is we're going to talk about a Psoas release with a technique using a kettlebell and some rock balls. This is a rock ball it's shaped after a lacrosse ball. It's pretty dense. This is the spiky ball from Rock Tape, part of their rock ball packages. Highly recommend getting these. Everybody should have a pair in their office or at home. Kettlebell, you can use anything too at home if you don't have a kettlebell. This is a 15-pound kettlebell, but you can definitely use a plate, a milk jug full of water, a 2-liter bottle that's full of water. Pretty much anything, just give you some weight to be able to do this release. Now the psoas muscle is a muscle that is really common in low back pain and anterior hip complaints. Big thing with the psoas muscle is that its actions are the trunk flexion as well as hip flexion. So you can see in our 9-to-5 warriors or our desk jockey type people, we're sitting a lot. They're sitting a lot, you're going to shorten that psoas muscle, so it's really important to release that thing. A lot of other people that get it are bikers who are in a flex position when they're flexing, extending their hip constantly. I know CrossFitters that have had a lot of issues with CrossFitters that have had psoas issues as well. So I'm going to show you a simple home myofascial release technique. Make sure you have something to bite on because it can be kind of painful, but it's like a good hurt. What we're going to do, if you have an elevated table or something, please use it. If you need to lay on the floor, that works as well. Also, you can do some other stuff with a box if you have a box at a CrossFit box. You'll start off laying down. Our psoas muscle can be palpated. Typically, how I educate my patients is you come to the point of your hip, move in about 3 fingers, okay? You can kind of palpate down in there. If you want to feel it move, if you move your leg back up and down, you'll actually feel the muscle contract and relax. It's a good way to feel it. And it runs from your lumbar spine down into the front of your femur and into your pelvis and then into the front of your femur. It's an iliopsoas. And so what we want to do is we want to take the lacrosse ball, feel where we feel the muscle palpation, put the weight on that lacrosse ball with the kettlebell, we put pressure down and add an angle into that muscle. Oh yeah, that's definitely tender. And then we would drop our leg through a range of motion, keeping that pressure steady, extending that hip, okay? We don't want to hyperextend our back, but we want to extend the hip. And then as we come up, we can take the pressure off. You can also put pressure on as you're coming up if you want to. I personally prefer to take it off and then do multiple repetitions. Usually spend about 3 to 4 minutes of time working on that psoas release. Don't overdo it, especially when you're first starting out. We don't want to injure you at all. If you have any questions, you can check us out at HealthSource at BismarckSouth.com. Also, our phone number, if you want to reach us, is 751-1660. Thanks and have a great day.